Cutaneous eruption in a U.S. woman with locally acquired Zika virus infection. Definition: Zika virus, a mosquito-borne flavivirus, is transmitted by the Aedes aegypti mosquito. As of December 28, 2016, more than 4,050 trials-associated cases of Zika virus infection have been reported in the United States.
On February 1st, 2016, the World Health Organization declared a public health emergency of international concern over the Zika virus. Here's everything we know so far. In 1947, in the Zika forest of Uganda, the first samples of the virus were isolated from a captive rhesus monkey. The next year, scientists recovered the virus from an Aedes africanus mosquito in the same forest. 4 years later, the first cases of the Zika virus are found in humans, both in Uganda and the United Republic of Tanzania. In 2007, the first large outbreak of Zika is found on the Pacific island of Yap, with 185 suspected cases. Prior to this, only 14 cases of Zika had ever been documented. On March 2nd, 2015, Brazil notified the World Health Organization of an illness causing skin rashes in the northeastern states. Zika was not a suspect at this point, so patients were not tested for it. As of February 2016, Brazilian national authorities estimate between 500,000 and 1.5 million cases of the Zika virus, and a total of 39 countries reporting local circulation of the disease. Zika spreads when an infected person is bitten by an Aedes mosquito, and then the infected mosquito goes on to bite someone else. If a pregnant mother contracts the virus, it can be passed on to her unborn child. Although the virus has been spreading quickly, only about 1 in 5 people who contract Zika actually become sick. The symptoms of Zika are generally mild, including fever, skin rash, red eyes, muscle and joint pain, and headache. The symptoms generally clear up within 2 to 7 days and can be treated with some common pain and fever medicines. What's troubling about Zika is the increase in a disease known as microcephaly in some of the countries that have known outbreaks of the virus. The condition causes newborns to be born with a small head, or have heads that stop growing after birth. If the smaller head affects brain growth, it may cause developmental disabilities. Currently, health officials are researching the possible link between the Zika virus in pregnant women and the increase in cases of microcephaly. It is recommended that pregnant women in the affected countries take extra precautions to avoid mosquitoes until more is understood about the virus. The World Health Organization has drafted a $56 million strategic response plan to provide surveillance of the Zika virus, control the spread of the Aedes mosquitoes, and support vaccine research. And that's the bulk of what we know so far. A lot of research must still be done to further our understanding of the virus and take steps towards developing a cure.
Applications in medicine. Histopathological examination of lesion skin reveal a mild perivascular lymphocytic infiltration in the upper dermis, admixed with some neutrophils. Zika virus was detected in both urine and serum specimens with the use of reverse transcriptase polymerase chain reaction.
Today, we're looking at the symptoms, diagnosis, and treatment of Zika. Anyone who lives in or travels to an area with Zika and has not already had the virus can become infected with it. In many cases, Zika doesn't cause any symptoms or causes only mild symptoms that last several days to a week. Hospitalization is uncommon. Typical symptoms include fever, rash, joint pain, and red eyes. Some people will also have muscle pain and headaches. If you've traveled to an area with Zika and experienced these symptoms, schedule an appointment with your doctor or other healthcare provider to see if you have Zika. Diagnosis of Zika is based on your recent travel history, symptoms, and a blood or urine test. Your doctor or healthcare provider may also test for similar diseases like dengue or chikungunya. Right now, there is no medicine or vaccine for Zika virus. If you develop Zika symptoms, make sure you rest, drink fluids to prevent dehydration, and take acetaminophen, found in products like Tylenol, to reduce fever and pain. To help reduce the risk of bleeding, don't take aspirin or other non-steroidal anti-inflammatory drugs until dengue can be ruled out.
Pros and cons of the treatment. On the con side, no specific antiviral treatment for Zika virus disease exists. However, the treatment is aimed at relieving symptoms with rest, fluids, and medication, such as acetaminophen and ibuprofen, to relieve joint pain and fever. Issue applying network. In the last year, there has been 135 cases, which include pregnant women.
The Zika virus is spreading, and mosquitoes might not be to blame. On Tuesday, the Centers for Disease Control and Prevention announced it's investigating 14 new cases of Zika virus in the U.S. that may have been transmitted by sex. Several of the cases include women who are pregnant. The CDC says 2 cases are confirmed, 4 tested positive in preliminary tests, and 8 other cases are still being reviewed. This announcement comes just one day after President Obama urged Congress to set aside about $1.9 billion in emergency funding to combat the virus. Zika is most commonly spread by infected mosquitoes and usually doesn't cause serious symptoms. The real concern is what the virus might be doing to unborn babies. Thousands of newborns in Brazil have severe birth defects thought to be linked to the virus. The outbreak prompted the World Health Organization to declare a public health emergency and the CDC to issue travel alerts for pregnant women. But it turns out you might not have to go far at all to become infected. According to the CDC, all 14 of the new cases being reviewed involve women in the U.S. who had sex with men who traveled to infected areas. The first case of Zika being sexually transmitted was confirmed in Dallas earlier this month, After that, health officials advised men who travel to affected areas to abstain from sex or use condoms during sex. As scientists continue to research the virus, the CDC reiterated safe sex practices Tuesday, saying these new reports suggest sexual transmission may be a more likely means of transmission for Zika virus than previously considered. For Newsy, I'm Katie Link.
Conclusion. Zika virus is a very common disease in our country. Therefore, people should be alert and assist to all the campaigns in order to prevent it.
Now to a developing headline in the Zika virus outbreak. Late word about some of the victims here in the United States. Now 36 cases in 12 states, and we now know 4 of those infected are pregnant. The virus, as we have reported, linked to a serious birth defect, babies born with their brain development interrupted. So what can those mothers do now, and what a top U.S. health official is saying now about the real risk here at home? ABC's chief medical editor, Dr. Richard Besser, at Ground Zero in Brazil.